Hello, everyone. I am Jenny Parker with the National Animal Supplement Council. Welcome to today's Preferred Supplier webinar, Beyond Compliance, Unlocking the Canadian Market for U.S. Companion Animal Supplements. Today's webinar will be presented by Paul Dick and Associates. And now it is my pleasure to introduce today's speakers. Ronaldo Avala is Business Development, Operations, and Regulatory Affairs Manager with Paul Dick and Associates, and is a skilled professional specializing in veterinary product development and regulation. With expertise in clinical trials, regulatory affairs, and global regulatory trends, Ronaldo has a strong foundation in both academia and industry. At PDA, he leads key business development initiatives, representing the company at major industry events, building strategic relationships, and driving growth across existing and emerging markets with a particular focus on expanding PDA's presence in Latin America. As a Brazilian professional fluent in English, Portuguese, and Spanish, he brings cultural adaptability and strong communication skills that support collaboration with stakeholders throughout the Americas and beyond. And Audrey Lavoie is Scientific and Regulatory Affairs Senior Advisor with over 15 years of experience in pharmaceuticals, natural health products, and foods and feeds, and has worked with organizations such as the Canadian Food Inspection Agency, Abbott, and Pfizer. Her background spans regulatory affairs, research, statistical analysis, and product development across human and veterinary health. She has led regulatory strategies, market assessments, and dossier preparation for global submissions, while also guiding proof of concept studies, safety and efficacy trials, and stakeholder engagement. Proficient in English and French, she is a unique resource for PDA's global research. And now I am happy to turn this over to Ronaldo to begin our webinar. Thanks, Ronaldo.
Thank you very much, Jenny, for the great introduction. Thank you all for joining us today, and thank you, Audrey, my colleague, for participating on this presentation. So today's agenda will start with the whys of considering expanding to the Canadian market in terms of commercial opportunities and trends. Then I will pass it to Audrey for her explanation on what VHP is, what is a supplement considered in Canada, in terms of classification, the claims and ingredients that are allowed in our country, the notification process, the GMP requirements, and post-market surveillance. Then we will cover some takeaways regarding the VHP registration process itself and close off with some case studies, given our experience in bringing products from the international markets to Canada. First, for those who don't know us yet, I'd like to introduce PDA. So we are a 16 years old consultancy firm providing regulatory, scientific, business, and commercialization support for companies in the animal health space throughout the board. So including pet food, supplements, biologicals, livestock feeds, and among others. Of course, today's focus is more on the pet food and supplement side of things. We cover a gamut of different jurisdictions. Being a Canadian company, of course, North America is our main market, but as Jenny mentioned on our introduction, we also bring companies to Latin America and help companies from other jurisdictions to attain markets in North America, Europe, UK, Asia, Australia, and beyond. Our team is formed by veterinarians such as myself, former regulators, Audrey, MBAs, and other more specialized associates as well. In terms of our clientele, it's very diverse, from academic and startups still on pre-revenue stage, all the way to strong local players, multinationals, and innovation clusters. In terms of our accreditations and memberships, we are part of the Canadian Animal Health Institute, through which we gain access to the regulators on a weekly basis to cover our concerns and bringing questions from our clients and from the industry itself. We are also members of the International Probiotics Association, which goes aligned very well with the supplement space in Canada, growing more and more on the biotics space, Pet Food Association of Canada, and of course we are proud members of the NASC as preferred suppliers. If you'd like to hear more, please use the QR code on the slides to gain access to our service offering and follow us on social media. So now getting into the specifics of why to consider Canada. Of course, most of you, I suppose, are already on the North American market, focusing in the US. Canada is considered a smaller market compared to the US, of course, but we say always that it is a very stable and trusted market, both from marketing opportunities, commercialization opportunities in numbers, really, as well as from the regulatory rigor and stability that we have in the country for supplements in particular. We saw a steady growth from the companion animal supplement market in the recent years, and we expect a growth of almost 10% from this year to 5 years from now, 2031, going up to approximately $276 million in value, which is considerably higher than we have seen in the previous couple decades. This relevant trend is driven by a few market drivers, so included maybe the top 5 here. And this is not only related to Canada, but in the animal health space in general, North America more specifically. These similar trends are seen in the US, of course. So pet humanization, oftentimes pet owners consider their pets part of their family. So if you have a elderly pet owner that is taking supplements for themselves to support their health, why wouldn't they do the same for their loved pets? In terms of preventative healthcare as well, supplements are seen as a very important aid on long-term healthcare, promoting healthy aging, health benefits for animals, not going directly on the prevention point of view from the regulatory perspective, but of course, with a complete diet, supplemented diet, your pets are well suited for a healthy and long life. The veterinary influence is growing more and more. So veterinarians in Canada are well educated in what is a supplement, there are barriers, where does a pet food end and where a supplement enters, and what is a drug claim versus a supplement claim. So they're very well educated in that sense, and they promote these products very well in Canada. In terms of science-backed claims, the pet owners, the final consumer are very well educated as well, which of course brings the opportunity for a premiumization of these supplements in terms of both financial value of them, as well as the potential of promoting this health for these animals. And as a supplement intended to be offered to the animals throughout their lives, the repeat purchase model, quite similar to pet foods, are also in place. Although we do have supplements for specific situations, many of them are implied throughout the life cycle of the animal. So from a commercialization standpoint, that's a really good trend as well. In terms of the demographics of companion animals in Canada, according to the Canadian Animal Health Institute's population survey of 2024, more than half of the Canadian households have a pet. We already surpassed the number of cats compared to dogs. I'm the proud cohabitant with 2 cats myself. So we have more than 8 million cats in Canada, 7 million dogs as well. And the surveyors were very clear that their pets are a key part of their lives and not simply a companion or one more thing that they hold inside of their homes. They're really part of their lives and families, hence their higher understanding of supplements and the benefits for that. As I mentioned, veterinarians are a very big driver of supplement selling in Canada. In terms of average veterinarian visits, we have dogs attending veterinary clinics twice a year on average, where cats go once a year. And in the past year, half of the surveyors identified that the dog owners and 1/3 of the cat owners have experienced health issues, those covering more serious ones, as well as more subtle ones that a supplement could potentially address. And one thing that I didn't mention before is that as in the US, the vet visits are down and the vet expenditure is also reduced given the economical factors that puts in our society nowadays, the supplements are seen as a very good opportunity to promote the health of these animals before getting to the point of bringing them to the clinic. In terms of product opportunity areas, these goals aligned quite well with the US trends as well. So omega-3 fatty acids for healthy aging, biotics in general, here included probiotics, but post prebiotics as well are very trending now for new products. Glucosamine for joint health, which goes along as well with healthy aging and etc. Digestive enzymes, biotics that assist on the digestive health, CoQ10 for cognitive dysfunction, healthy aging, promoting good cardiac health, everything around promoting health, keeping your pets healthy and alive for longer. So now getting to a little bit of the specifics before I pass to Audrey about the VHP pathway. So before the Veterinary Health Product Program was released, the natural and wellness-based animal products often fell on a gray zone between non-regulated products and drugs. So the interim notification pilot program was launched to prepare for the development of the veterinary health product program that we have nowadays. As a little fun fact, Dr. Paul Dick, our founder and president, and Bill Bookout from NASC, both were involved on this early stage of what today we know as the Veterinary Health Product Notification Program, which was officially released in 2017, replacing the pilot, the interim pilot that I mentioned. And today the program is very well going and stable. It's a fully regulated companion for supplements in companion animals in Canada, with continuing improvements and updates as the industry demands those. And we're going to get to more the specifics following Audrey's section. Over to you, Audrey.
So what is a veterinary health product exactly? So the definition is pretty simple, but the boundaries sometimes are not. Sometimes you have products that can really end up in those gray zones and those boundary crossing areas. So according to Health Canada's definition, it's a low-risk drug and dosage form, which is used to maintain, promote the health and welfare of companion animals. So it is not used for treating, for preventing, or for curing diseases or symptoms of conditions. So typical VHPs we find are vitamins, minerals, biotics, traditional medicines, as well as homeopathic medicines, and any other substance that is currently included in the list of permitted substances. So VHP is not just a pet supplement or not just a pet food with better claims. It is an actual regulated low-risk drug category with their own labeling, ingredient notification, and GMP and post-market rules. Next slide, please. The line for VHPs is mainly with intended use. So claims, presentation, and mode of use will determine what lane the product goes under. So for example, claims do include label claims, but they also include claims used in or statements used in advertising, websites, imagery, and that imply therapeutic meanings. For the ingredients, we're looking at mainly permitted status, permissions for that mode of administration, that species, and those dosages, and as well as specific cautions and label restrictions. In terms of form, we're looking at dosage form and the route of administration. So, for example, we're pretty commonly aware of oral dosage forms in companion animals such as chews and treat type forms, although they aren't treats, versus you'll have other forms that are maybe a little bit more difficult. You got otic or skin and things like that. The evidence required. So you do need some evidence that it is safe in the species intended and that there is an expected benefit. So it is fit for the purpose that you are stating it will do. But you need to make sure that the studies that are used to support these benefits are not drug type studies. So, for example, things like, challenge studies sometimes, are going to go too far. So the VHP classification is as outlined here. You got your purpose, which is your claims, your intensity of the claims, which are general health conditions, very general, very broad, and aiding in certain chronic conditions. Aiding and supporting are the, aiding, maintaining, supporting are the kinds of words and qualifiers we oftentimes find in these products claims. Once you are marketed and once you're notified, before you can put your product on the market, you do have to get a notification number, and that will be assigned to you by Health Canada. And then once you have that number, you put it on your label and you can put it on the market. So it does give a very clear statement to consumers that this product has been reviewed by Health Canada because of that number. The evidence burden is that you do have, you can require a significant amount of evidence to get your product listed if Health Canada does request it. But it is more at the substance level and the ingredient level and not at the full product level. Although there is a attestation required when you notify your product that you are stating that everything that you have put in there is accurate and true, including your claims, that the product's going to do what you claim it does. On a commercial upside, because of that notification number, because of that review, you can sort of request a premium. You can have that premium supplement positioning, and it is also a rather quick overall timeline. So for the notification itself, once you have all the ingredients on the list of permitted substances, it is a 30-day minimum pre-market notification. So once your application has passed screening, Health Canada is to provide that final decision, usually a notification number, within 30 days. So claims really are the regulatory engine for this. They really are what drives this. So you've got little differences in wordings can, affect this. So the lowest risk claims are ones that just talk about the ingredients that are contained. So for example, a product that contains omega-3 fatty acid would have a claim that says source of omega-3 fatty acid. Simple, easy, does not imply much. A good typical VHP claim would be something like supports the function of the immune system, supports a healthy gut flora. Those kinds of claims do, intentionally mention the benefit that it will do, but is not stating anything about any conditions or diseases that it might have an effect on. So the high risk claims, which are those that you see mainly in drugs, are ones associated with pathogens, diseases, treatments, preventions. So, for example, prevents E. coli diarrhea or reduces inflammatory flares from arthritis. Next. So here are some examples of claims that you can see on VHPs and words that can be wording that can be problematic. Some of these we found in our experience, and others that we have in registering these products for clients. So I'm going to go over a couple examples. And first of all, digestive, which is a nice up and coming or continuing to come area of natural health products. So you commonly have claims like promotes a healthy gut flora, maintains the balance of the microflora, maintains stool quality, normal stool quality. Those are great. But when the watch out wording is things like preventing pathogen colonization, treating diarrhea, if you know notice that they both have prevent and treat in that, and mention specific conditions in the case of diarrhea. Those become problematic and point towards a drug route. In terms of joint health, which is another pretty busy and pretty trendy area for supplements, you oftentimes, and especially in older pets, you have claims of subpoints joint health and mobility. These are very, very common claims. Great, no problem. And, very clear to consumers what the product does. When you take it that one step further and you're talking about treating osteoarthritis or mentioning osteoarthritis or reducing joint inflammation, that goes into drug territory where it is problematic. Another set of claims I'm looking into I'm going to mention are the urinary claims. So you have things that helps maintain urinary tract health. That's once again talking about keeping the normal function going, keeping things going great and as they should, versus watch out wording, which is like prevention of urinary tract infections. Once again, now you're looking at the disease condition and preventing it. So that goes into the drug category. As well as you're making sure your claims are where they should be, you need to make sure that your ingredients are ready. So claim polishing will not fix your ingredients if you have ineligible substances. So for example, you need to know the status of your substance. Are we talking about, standard, you can say, veterinary natural health products, or are we looking at homeopathic or traditional medicine-based treatment modalities? And then you have also to make sure that both your active ingredients and your non-medicinal ingredients, so any carriers or excipients, are all listed on this list of permitted substances for the use you have. So for example, if you have an ingredient that can be both used homeopathically and as a standard supplement, then you need to make sure that it is listed for the use you will be having of it. And you also need to make sure that it is listed for your species, your route, doses, and that the cautions and conditions your product meets. For example, in certain products, there will be limits of how much you can have, the inclusion limits for these ingredients, and you need to make sure that your product meets those. Additionally, you have to make sure that your ingredient is not on the prescription drug list. And if it is on the prescription drug list, because occasionally some ingredients that are on the prescription drug list can be used in veterinary health products, but it has to meet specified conditions. So if your ingredient is on the prescription drug list, make sure that you meet the conditions if there are conditions. If the prescription drug list does not mention conditions, then unfortunately that ingredient is ineligible for being used as a veterinary health product. But what happens if your ingredient isn't listed in the list of permitted substances, but is not on the prescription drug list? Well, then you need to get it added to this list. You can do this in sort of a stepwise approach. So the first step is what's called the short substance application. So that is routine, mainly also very much used for changes to products. So for example, if your ingredient is on a list but not in dogs and cats, which is your species of interest, then you can use the short substance application quite easily to modify the listing. This is usually the first step, that first doorway that you open up to Health Canada being like, we want to bring this ingredient as a veterinary health product. If Health Canada requires more information, or if they think this is not the right route for it to be added and they have lots more questions, then they will send you off and request a long substance application, which is usually abbreviated as LSA or sometimes ASA. So this is a longer pathway. This is going to require a full package demonstrating the safety of your product, demonstrating that it is fit for purpose, then all of that for your mode of administration and your species of interest. And they're looking at things like safety, history of use, quality, all these kinds of factors. And these long substance applications are mainly based on peer-reviewed published literature. Once Health Canada is happy and content with whether your short substance or long substance application, they will then add it to the list of permitted substances, assign it any caution statements that they require, and make that listing. So once your product, all of your ingredients are listed in the list of permitted substances, you're ready to move to the next path, which is notifying your product. So when you're talking about a product level notification, what is it that Health Canada sees? So they're going to see things like your administrative identity. So who the notifier is, if you are an international company, which many of you are coming from the US, who your Canadian representative will be, as you need a person who resides on Canadian soil to act as your representative. The information for manufacturers, importers, your product name, all of that. Then they will then get information on your product characterization. So things like dosage forms, species, routes, source of your ingredients, the function of the various ingredients, especially excipients, and your directions for use. Then you go into your regulatory positioning, which is claims, any cautions and warnings and risk statements, the bilingualism of your label. So, for example, all of these statements are going to need to be both in English and in French on your label. And then you have quality requirements. So your quality and life cycle requirements. So for the quality requirements, you do attest when you are submitting and getting the notification number that this product is being made and produced as per CGMP standards, or in this case. So you do need to keep all of that information, including your stability and your shelf life, all within your own personal records, so that if you ever do get audited, they're ready, it's available easily for Health Canada, and you have demonstrated that you do meet what you attested to. Next, you have life cycle obligations. So you do need to maintain a bit of a pharmacovigilance system. You don't need to report them, but you need to gather any adverse events, any events at all related to your product, any complaints, any recall, and make sure you're ready for a recall if necessary. And so you do need to keep these in sight, and you also attest to the fact that you have a system in place. This is unlike drugs. You're not submitting, periodic statements with this information, but you can be audited at Health Canada's discretion for these events. Next. So VHPs are lower burden than drugs, but quality is not an option. So they do still need to be produced at a high quality level, as governed by the rules for CGMPs for natural health products. These are the same CGMP rules for human and veterinary natural health products. So you're referencing the human guide when you are reviewing for veterinary health products. So things like, making sure your product has proper specifications, making sure you're keeping all required records, your operations, manufacturing, packaging, labels, storage are all controlled, and that your stability is being followed, and that your stability or your expiration date is actually based on stability testing. As I mentioned earlier, you also do need to have a process in place in case you have deviations to your production or need to make any recalls, how to investigate complaints, all of that. So the post-market surveillance is still an important piece, although it isn't directly audited generally by Health Canada unless Health Canada decides to do so. So the core of this is maintaining surveillance of adverse reactions, including serious adverse reactions, maintaining systems for these reports to be submitted to your company, assessing, following the reports, records, escalating them, doing the investigations to figure out what the source of these complaints are, and recall readiness as necessary. So in terms of business, the post-market system, it protects the products. It helps to preserve trust with retailers and veterinarians. It shows that you are truly caring about your product, you're keeping an eye on things, and that if something were to happen, that trust is there that you will notify the consumers and the retailers and your distributors and everyone quickly and can handle this to keep animals safe, of course. So the take-home message is that VHP requirements are quite similar to NASC's requirements. It is a claims-driven classification, but ingredient eligibility is the first gate, and that the notification process is quite efficient when you are ready for it and your product is aligned. And commercially, veterinary health products are much more powerful than, say, another lower level product, because they do have that reputation and that assessment of safety and confidence behind it.
Perfect. Thank you very much, Audrey. So now we would like to share with you 3 case studies that we got in touch with in the recent past. Some of them from companies coming from other jurisdictions, some of them from Canadian companies registering VHPs in Canada. So something to take into consideration in terms of compliance is the product naming. So we have 2 cases in one, if you will. Product 1 is a product that has a brand name referencing one of their non-medicinal ingredients, in this case, a carrier and flavoring ingredient. And the other product had multiple claims associated with the product. However, only one of these claims were referenced on the brand name, not all of the other ones. In both cases, Health Canada did not fully agree with the notification that was filed. In the first case, they indicated that once you have one of the ingredients as a brand name, this ingredient must be an active ingredient and could not be a non-medicinal ingredient. In the second case, once you have a product name referencing one of multiple claims, you would need to either reference all of them on your brand name, which is unfeasible, or include a plus, literally a signal plus after the brand name, indicating that there are other claims associated with this product. In both cases, PDA, they were both clients of ours. We indicated that these changes were not fully aligned with the guidelines that are publicly available, and we requested Health Canada to review their positioning, given other products on the market that are not facing the same scrutiny and just the lack of legal basis for these requests. Both products were happily approved with their original names in place after we got back to Health Canada. And what we learned from this lesson is from this case is that oftentimes Health Canada suggests change, but it's not necessarily a requirement for submission, and oftentimes they are not even based on the market itself, on other products that are available, and on the guidelines. So be very aware of the actual requirements for VHPs in Canada and how to position your product well facing the guidelines and other products that are on the market with similar claims, brand names, everything around your notification as a whole. And Health Canada does welcome dialogue. So once they get back to you asking for a change or declining a submission, you are able to appeal for that. Oftentimes we get into the picture after a client of ours submit by themselves, don't get quite the correct or ideal results from Health Canada, and we try to revert this situation. So be aware of that before you get to Health Canada. Usually they give very short times for appealing, oftentimes 5 calendar days. So before submitting, be prepared for potential outcomes of Health Canada bringing to your desk, so you comply with the timelines that they submit you.
So our second case study regards inconsistent claim review. So in this case, we had a client who submitted a product, we helped them submit a product where the claims were modeled on previously registered and notified products. During the review, Health Canada advised that those claims cannot be made and suggested modified wording. So what we did as PDA is we went back to Health Canada and argued that the claims should be permitted because of the precedent and similar claims being already accepted and made for comparable products, and that the claims themselves were compliant with the regulations and the guidance. So the outcome for this case was that the claims were permitted for the product. As lesson learned, prior precedent is helpful, but it is not enough. The claims should really be supported by a clear rationale, scientific, and we should have fallback wording just in case. So even when the claims are modeled on previously notified products, Health Canada might still request and still challenge the wording to these claims, since claims are very much central to this process.
Just to complement of note, at the launch of the Veterinary Health Product Program in 2017, it was a way much more safety-based approach compared to nowadays. So they're more on a risk basis rather than proving efficacy and claims of this product. So some of products that were submitted and approved quite a few years ago may not be approved nowadays with the changing the regulatory red tape and how they apply the regulations. So leveraging currently marketed products is interesting, but as Audrey mentioned, oftentimes it's not sufficient just because you have a competitor on the market. So take that into consideration. This is probably one of the more tricky and complex cases, which is non-compliant website. And we say website because it is the type of marketing material that the regulators can have easy access to, but that also includes flyers, printed materials, presentations at events and whatnot. So a client of ours had a probiotic already on the market for years in the US and the EU. On their global website, they referenced a study that proved an inhibitory effect on bacterium, which Audrey mentioned previously, that falls in Canada on a drug category rather than a veterinary health product. This website was not sent to Health Canada. Nobody shared the link with Health Canada. They actively looked for it and found this advertisement. And including studies on your website are considered advertisement. Therefore, Health Canada, of course, came to the conclusion that the product would be better regulated as a drug, moving it out of the veterinary health product pathway, which is very suboptimal for the perspective of this specific product, given the timeline for market, the data package required to approve a drug versus a VHP, and etc. And we, as service providers, we argued to Health Canada that a specific website for Canadians would be created following Health Canada's guidelines in terms of claims and advertisement, without the claim being made for pathogen control as a consequence of this given product. In this case, unfortunately, we could not revert it. That's something that usually happens, and even from the livestock feeds space through CFIA, that's also quite common to happen. The product classification was maintained as a drug, and the product was not brought to Canada because it was just unfeasible for this specific product to pass through all the regulatory burden of a full regulated drug. As a lesson learned, which we always encourage our clients to think about before getting anything in front of the regulators, is that everything besides your label are considered an extension of it. That includes websites, that includes marketing materials, printed in blogs, Instagram, whatnot. And oftentimes, even if you have a manufacturer, say in Europe, that manufactures a given product for you in Canada and for other company in India, whatever, if your manufacturer that you identified on your submission makes claims that are not approved in Canada, even if it's not you who made the claims, if it is your manufacturer, Health Canada may get a hold of it. And if they do, they will not classify your product as a VHP, in bringing serious commercial implications. So the main takeaway, always review all your website content, mainly because once again, that's what the regulators can have easy access to, and other materials before putting any notification application in front of the regulators.
So one thing to keep in mind regarding this case is that in this case, Health Canada had made a decision that the product was a drug and not a veterinary health product. Once Health Canada makes that decision, it can be very difficult. We have had some success in the past, but once Health Canada decides something is a drug, which is sort of the highest level of regulatory scrutiny that they apply to products, it's very hard to go back from that. It's much easier to go in with everything settled, ready, and controlled to avoid that justification than trying to change their mind after that unfortunate classification has been made. Like I said, we have had some luck in a couple rare cases to get that classification reversed. But and we do, if that classification, if you end up in that situation where a classification like that is made, we do encourage you to try to appeal it, given the appropriate scientific backing and information. But it can be difficult, and so you do have to keep that in mind. It's better to prevent than to remedy.
Perfect. Thank you, Audrey. So that being said, just to close off our presentation and open for discussion, how can PDA help your business in Canada? So of course, we can develop regulatory assessments, both on the ingredient and claim level, to understand if your product will be actually classified as a veterinary health product in Canada, if any minor changes will be needed, what will they look like, and how we can help with it. Should you need to include one ingredient that is not currently listed on the list of permitted substances, we can file short substances and large substance applications on your behalf. As Audrey mentioned, everything in Canada must be bilingual. Everything client-facing must be bilingual. So we offer label adaptation and translation to French. Of course, we can prepare and submit a full notification on your behalf, serving also as your Canadian representative for companies that do not have a Canadian office. We do also offer compliance review of website and marketing materials, once again, ideally before getting to the submission stage, to ensure that you are compliant. And that goes hand in hand with NASC as well, because as you saw, most of the claim permitted in Canada are also aligned with the NASC claims table. So we could do that on a parallel manner, if you will. And something that we didn't touch much on the presentation today, but we also offer support in clinical trials for claim substantiation. So we have partnerships with CROs, academic institutions in Canada and abroad that can, under our purview, under our regulatory expertise, develop clinical trials to promote your ideal claims for your products. With that, I would like to thank you all again for being with us here, thanking NASC and Jenny for the great support as always, and we encourage you to book a one-on-one with us to understand your case, if you need any of our assistance, or just exploring a little bit more in depth any of these topics that we discussed today. Thank you very much. I'll be happy to have any questions.
Thank you, Ronaldo and Audrey. I appreciate that so much. Great presentation. And we do have a couple of questions that we'll go through now. First, if your company maintains separate websites for different regions, would this still be considered problematic by Health Canada, given that regulatory requirements vary across jurisdictions and region-specific content may be necessary to comply with local regulations?
So I'm going to speak to that. If your Canadian specific website for this product is already set up, and you can include a coming soon kind of notice on your website so Health Canada doesn't get scared that you're already marketing it, then then that's fine. But basically is if they Google your product, what are they going to find? Are they going to find your international website, which is going to have problematic claims, or are they going to find your Canadian specific website, which has everything aligned with the regulations and the guidance?
Perfect.
Next question. We were trying to submit a product that is topical for dogs on the VHP website, and many ingredients were not available, so we couldn't even attach something as simple as glycerin in the submission. Do you know why that would be the case?
Yeah, I can speak of that. That goes with the list of permitted substances topic. So glycerin may be already included for other applications. So for example, oral, but not currently for topical use. So through the short substance application, we can ask Health Canada to update in this case, the registration or the listing for glycerin to expand on the indications. And that's also true if you have ingredient that is listed for livestock, say, that you want to use for companion animals. You can also ask Health Canada to update the listing to allow you including that. So on the drop-down menu, you're not going to have this option until you have updated the list to allow you using this ingredient for a given species, a given route of the administration. So probably that's why you could not include that. And that we see very often, even for very known basic ingredients. Recently, we included one listing for hay for horses. It was part of a complete diet for horses. Horses have been eating hay for centuries, but it was not on the list. Now it is. So it's not as simple. It's not as simple as it may sound, but it is definitely something we can assist you with.
That's wild that hay was not on the list for horses.
A specific hay species, I should say. So
Interesting.
Timothy hay, alfalfa hay, they're different ones. So we included one more.
Interesting. So a related question, is the list of permitted substances available on the VHP/Health Canada website?
Absolutely.
Yes.
Yeah.
Yes. Okay.
It is
Perfect.
publicly available. You can look for both notified products, so finished products that are on the shelves, as well as for all the ingredients that are listed. It's
Right.
publicly available.
Wonderful. Next question. Who is allowed to act as a Canadian representative for submitting a product? We use a third-party Canadian company that specializes in that, or it says, do we need to use a third-party Canadian company specializing in that, or can we use one of our manufacturers in Canada as a representative?
So the requirement is that the person, because it's an individual, not a company, that acts as representative, the person lives on Canadian soil, has a Canadian address that they can use, and are in a position that are capable to attest to what is required. Things like you're attesting to the quality, you're attesting to the presence of a post-marketing surveillance system. If that person, that Canadian representative, is in a position that they can attest to that, and they do live and reside on Canadian soil, then they can act as a Canadian representative.
Yeah, just to complement on that, be mindful that the Canadian representative is the front line between Health Canada and you. So should your product be required to change a caution statement, which happened recently with clients of ours, we will receive this information. So if you are using your manufacturer, for instance, that is potentially very busy with other things, and given the regularly short timelines that Health Canada allows you to make these changes, be mindful that you may miss important communication. So without trying to oversell our fish, we are specialized on that and we live for this. So we every day open our various profiles in Health Canada, and we review if there's any news on that. So just be mindful of the time pressing situation for communication with Health Canada.
All right, thanks. Next question. What are the review timelines for ingredient applications, short substance application versus VHP product application?
So there are no official timelines for ingredient applications themselves, but in our experience, a short substance application, usually you get an answer to from about 30 days from submission. You'll get either questions asked or, great, thank you very much. We've added it to the list, which is always what we want. So that usually happens within 30 days. For long substance applications, it can take a month and a half to 4 months, depending on the workload and how many are coming in for Health Canada. For the notifications themselves, there is two periods. There is a screening period and the period once you've passed screening. So once you've gone past screening, you have 30 days, and Health Canada is held to that. They also can only ask a specific not number of questions, but sets of questions. They can only ask, here's your question, you give a response, and then they can ask follow-up questions, and that's it. After that, they do have to reject if it doesn't pass. So as such, they do try to load a lot of these questions in the screening period. So the screening period can take a little bit longer, but usually your product is screened within 2 weeks. I find sometimes 3, and then you move on to that notification period of 30 days.
Okay. Next question. Has PDA submitted successful LSAs? All of ours have been unsuccessful. Are there examples that can be found anywhere of successful submissions provided by VHP?
Yes,
so we have,
yeah. So go ahead.
So we've submitted them both recently and back at the beginning of this program when the LSA process was the only process you had for adding ingredients. So we have successfully submitted long substance applications. Unfortunately, we can't provide you with any of these examples as we are covered by confidentiality and NDAs with our clients. But internally, if you were to contract us to help you with a long substance application, we bring all of that experience to your application. So without being able to provide us with specific examples, we know this is going to be a problem. This is going to work. We have that experience.
Yeah, and to add to that, also, if you share with us after setting a CDA in place, of course, the reasons why Health Canada didn't approve it, we can understand if it is an ingredients problem or if it is a submission problem and how to circumvent that. We see LSAs being applied mainly for biotics, given the higher safety concerns for this category. It may be your case, may not, but there are ways to circumvent that and, develop a file that is more likely to be approved. So please feel free to reach out.
In the world of biotics, there are specific requirements that, although not published by Health Canada, and any other guidelines that we know Health Canada is going to ask. So we know they're going to need these items to be part of your submission so that you can successfully get that submission across. And in terms of other products as well, there are certain unwritten requirements that Health Canada has internally that through our experience we have found.
And just to complement that once again, through the Canadian Animal Health Institute, which we are members of, and we sit on all of their committees, including the VHP committees. If you have a case that we really don't agree with Health Canada's positioning, we can escalate that through CAHI and get a hold of the regulators specifically to address your concerns through a formal appealing process as well as a more informal communication and getting a better understanding on the why. We know all the reviewers by name because they're not so many. So we are more than happy to help you escalate that issue.
An example of this is in our case study when we mentioned the brand names that had a plus. Yeah. That the Health Canada was listing a plus. This was a common issue that many of the member companies of the CAHI committee were facing. So when we had a bilateral with Health Canada and the VHP group and the reviewers, we were able to bring that up and amongst other issues, of course, and Health Canada actually committed to not doing this because the plus is quite frankly a brand name is a marketing consideration. And so as long as they're not misleading or sound like look-alike, it should be fine. And that was something that we were able to get a commitment for and a change going forward.
Great. Next question, I'm actually going to combine two questions from different people because they go hand in hand. First, do all pet dietary supplements need a VHP notification number? And then, is a placeholder notification number and a placeholder barcode adequate to put on the label when submitting to Health Canada for review, knowing that both will be added after approval?
Yes, so when you put in your submission, you don't know your notification number. So normally when you'll put in your example, labeling, when you get your labeling ready, it'll be NN, and then we usually put a bunch of X's for ourselves. That's our strategy. And that's a placeholder position. But you do need to have all of your supplements and your veterinary health products registered with Health Canada. If not, they're considered illegal. They're considered not only illegal, but they're considered illegal drugs. So you're marketing a drug without authorization because veterinary health products fall under that umbrella of drugs, which can have some severe sanctions, and you really don't want to face that problem. And so you really do need to get that.
Yeah. Jenny, if no one has asked about functional treats, I would like to speak of it briefly. What do you
Yeah,
think?
let's go ahead with that.
Yeah, so oftentimes when we talk about veterinary health products and supplements, frankly, both in US and Canada, the question that comes is, what about functional treats? Functional treats are not a regulatory classification formally. You either are a treat and you're just intended to bring to get a better connection with your pet without any further health benefits for training purposes, etc., but not intended to bring any actual health benefits. So if you are a functional treat and you have that you on the label that you support gut health, say, or joint mobility, you are not a treat, actually, you are a supplement. And as such, you are required to have a notification number and have being approved by Health Canada. And if not, as Audrey mentioned, you are unfortunately out of compliance, and that can bring you some serious issues moving forward. So there are treats in Canada, they're not regulated, but once you have claims that goes along the lines of health claims, as Audrey mentioned, many of them today, you are not a treat anymore, you are a supplement. There are distinction between a supplement and a treat on the claim level, which we addressed, and also on the format manner. So a chew can be a treat or it can be a supplement, depending on the ingredients, depending on the claims you make. So looking like a treat doesn't make a product a treat, depending on the claims and ingredients that you have. So this distinction is quite important to be made.
And it's simple things like, you'll oftentimes see it in things that say they, help clean teeth. In dog treats, you'll have a lot of those dog treats that will have that function, usually mechanical, of helping to remove some of that tartar buildup on the teeth. Those are going to fall under. So if you're helping with oral health, then you're falling under a supplement, even though it's that little, it's the same little treat presentation. You're giving this little kibble or little cookie to your dog, and it helps clean their teeth. Then it's a supplement and not a food. So treats fall under foods. So there are things like if they feed the animal, if you have a claim associated with like, great flavor or tastes like peanut butter, because dogs love peanut butter. Those are okay, but as soon as you go put things like, helps clean your teeth or helps with your joints, then you stop being a treat at that point and you turn into a supplement.
Exactly.
Okay, we still have some questions pending, and if you two have time to stick around and we can
Absolutely.
go ahead and, yeah, okay, let's keep going then, and then we'll have it captured in the video. Next is, can you go into more detail as to what is meant by drug studies versus VHP studies? What suggests that something may be a drug study?
So the big thing is how the study is set up. So if all of a sudden you're using, for example, diseased animals, now you're problematic. So for example, if you're looking at a joint health product and you're using animals that have diagnosed osteoarthritis and you're looking for an improvement in symptoms, you're now doing more of a drug study. But if you're looking at the same compound, but instead you're getting otherwise healthy dogs, so dogs that are not diagnosed with osteoarthritis, but old dogs, and you're looking at improvements in health. So, are they moving more? Are they, those kinds of claims that you're looking, those kinds of endpoints that you're looking at, um, and not, necessarily pain, not function, but like, are they moving more? Are they happier? Does your dog's overall well-being improve? That will be more of a um, supplement study. And then you have studies for other things, like, for example, helps improve the immune system. If you're all of a sudden quantifying, you're looking at 6 dogs, or you're starting to quantify the immune system in very strict detail, then you can start running into trouble. But generally, you want to do it in otherwise healthy dogs, dogs with no diagnosed conditions, or cats. But animals that don't have any diagnosed medical conditions is the big one that really does differentiate drug versus non-drug study. And then some of the measures you're taking will also differentiate drug versus non-drug study.
If you're talking, you're on mute, Jenny.
My apologies, I'm so sorry. We are having issues getting certain highly processed ingredients approved for import without an import permit. For example, green-lipped mussel. It is not on the APHIS application as an exempt ingredient, but it is listed in the notice to industry changes to import requirements for supplements as exempt. Any input would be appreciated. And they provided a link in the question box. I don't know if you're familiar with this document they're referencing.
So when you're talking about importation, your HS codes will change. If you're talking about things for or a fully registered veterinary health product, or ingredients that are going to be used in the manufacturing of registered veterinary health products, you're now leaving the feed and food type commodities, and you're going into the drug type commodities, which is which makes a big difference in terms of what codes you use and how you import these products.
Yeah, that said, once again, please feel free to reach out to us so we can get a better understanding of the situation and try to assist you the best we can. On a high level, Audrey covered it well.
Next question. What is the process to make an ingredient change to a registered product?
So you don't change an ingredient to become a registered product. So all of the finished products have multiple ingredients, usually. They might be a single ingredient, but that's not very common. And then all your ingredients on the finished product need to be listed for the given species and indication that you want, route of administration. And then you file a new submission registering a finished product.
So if
It's
you have
more
a
on
product,
a
yeah,
it's
sorry.
more like a condition that your ingredients are listed, so you file for a finished product rather than changing from one to another. They are independent lists, but all your ingredients on the finished product must be listed. So you don't.
And
I
the
think what
other
they're
thing,
asking is
yeah,
what if you make a formulation
yeah.
change?
So if you have changed the formulation of your product, that is no longer considered the same product. It will be considered a new, different product, and you will need to notify that product again. Luckily, the notification fees aren't too expensive. And there are small business mitigation measures that come into play. But you do need to re-register that as a new product, getting a new notification number. And so on the one plus side is you can have both formulations on the market at the same time. But on the minus side is it's not just a simple amendment of an already existing registration, but a new registration that will come into play.
Thank you, Audrey. I think I misunderstood the question. Thank you.
Okay, next question. In the very end of the submission for a homeopathic, there was a drop down with the units for each of the ingredients per dose. Not even our manufacturer's chemists knew what those units meant, and we couldn't find anything online. Is there any information on the Canada Health website that I am just not finding?
So for homeopathic, they have their own, system of units, and it's according to their compendium. So you do need to know how much of everything is in your product. That is central. Whether you're talking about a homeopathic, a traditional medicine, or standard veterinary health products and supplements, you need to know how much of everything is in your product. Homeopathic remedies do have their own specialized units. Believe they are more detailed and explained in the compendium, and you do need to follow those. Um, so unfortunately, if your manufacturer can't tell you, you might have a problem on your hands. But we can definitely, that's something we can help with. We have recently, actually, I submitted it today, where the formulation of a product, there was some salts in the product, and the manufacturer and the notifier had the formulation, because they were getting these salts as solutions. And so the formulation was all marked in milliliters, and we're like, no, Health Canada is going to come back and see this is a salt, therefore it's a solid. How many grams are it, and what's the concentration of your solution? So we know exactly how much of that salt is in the final product per dose and overall. And so we had to get the manufacturer to, unfortunately, to do some digging and give us those quantities. And once we had those quantities, we were ready to go. And as I said this morning, I submitted that notification today.
All right, thank you. Ronaldo's cat has joined us.
Yeah,
Next question,
it took some time.
oh, what a cutie. If we have a product that has been an approved drug in Canada, but we have shifted to being an animal health supplement, VHP, what issues might we see?
So we do see this on the human side more commonly, because previously on the human side, I'm going to use toothpaste. Toothpaste could be, before it could be a drug, or it could be a consumer product. Nowadays, toothpaste can be a natural health product, a drug, or a consumer product, depending on the ingredients. So we have had that happen with the advent of the Veterinary Health Products Program, and the Natural Health Products Program on the human side. Some of these products they used to be marketed as a drug, but they are shifting to be marketed or potentially put into a VHP. So when you would register as a VHP, you're going to be registering a different product. So you can maintain the former drug products. The one thing I would caution against is being too quick in making these changes, because if your drug product is already registered in a DIN and you're happy paying the fees required for your annual renewal, etc., having it listed as a drug with a DIN does provide you with some premiumization, does provide extra confidence, but you can have a similar product listed as a veterinary health product as well. As long as the ingredients all meet the requirements, your claims meet the requirements. And once again, that's where the prescription drug list comes into effect. None of your ingredients are on a prescription drug list.
You are a trove of information. So interesting. Just a couple of questions left. First, does the number need to be, I'm assuming they mean the registration number, need to be printed on the label?
Yes.
I figured. And then finally, we have an attendee asking whether an initial consultation with Paul Dick Associates comes with a fee, or is that complimentary?
No, our introductory discussions are complimentary until the point we identify a scope of work, or if it is a quick question, and we're more than happy to assist you with. Once we identify a scope of work, then we can put a proposal in place with the items that we're going to cover, timelines for deliverables, associated fees, and then we have multiple interactions with you until we find a middle ground for what is interesting for you from a both business and regulatory perspective. And then we start fully engaged, formally engaged.
Excellent. Okay.
So yeah, that initial consultation is free. We will then, generally get a sense of what your needs are. And from there, like Ronaldo said, if there is a place for a larger project, we will do that fully customized proposal. It really is customized to each individual client's needs.
Wonderful. We did it, guys. That is the
Fantastic.
end of the Q&A. Thanks to everybody who hung in here with us as we navigated the list of questions. And with that, I just want to thank everyone for joining us today and for participating in the webinar. And also a big thank you to Ronaldo and Audrey for presenting. A reminder that today's webinar will be archived on the NASC website, and we will also post the slide deck as well. And we hope you'll just share this presentation with anyone inside or outside of your organization that you think could benefit from this knowledge. And again, thanks to Paul Dick and Associates for presenting today. We appreciate you.
Perfect. Thank you very much.
Goodbye.
Bye-bye.